Welcome to the Quantum Biology Collective podcast, where we break down the practical strategies of this emerging science, starting with healthy light habits and going wherever the quantum superhighway takes us. This is your host, executive and life coach Meredith Oak, with a quick reminder that podcasts are conversations, not consultations, and definitely not medical advice. We're here for informational purposes only. To follow up with our amazing guests, please do check out the show notes, and to stay in the loop with the QBC podcast, join our email list, also linked in the show notes. Okay, here's the situation. A patient has come into the ER. He has a very bad case of COVID. He gets admitted. They try everything. Nothing's working. And they are on the brink of intubating him because he can no longer breathe properly. Before they do that, a renegade doctor comes in and says, listen, let's just try one last thing. And here's what he suggests. He wheels the patient along with his oxygen tanks outside and has him sit in the sun for 20 to 30 minutes. Okay, this intervention actually happened for real at a hospital here in the United States. And the doctor who masterminded this operation is called Dr. Roger Seheult. He is a little bit internet famous because he has a company called MedCram, which has over 1 million subscribers on YouTube. And he provides medical teaching and academic teaching in the field of medicine on this website. However, he's also a highly credentialed doctor. And I'm just going to read through the quite long list of all the ways that he's credentialed, because I really want to make the point that this sunlight stuff is not some wingnut fringe theory. It's real. The research is serious and doctors are really starting to take it seriously. Okay, so here is Dr. Roger Seheult of the Sunlight Prescriber and his long list of credentials. Okay. Dr. Seheult is currently an associate clinical professor at the University of California, Riverside School of Medicine and an assistant clinical professor at the School of Medicine and Allied Health at Loma Linda University. Dr. Seheult is quadruple board certified in internal medicine, pulmonary diseases, critical care medicine, and sleep medicine, all through the American Board of Internal Medicine. Dr. Seheult's current practice is in Beaumont, California, where he is a critical care physician, pulmonologist, and sleep physician. And he is also the director of a sleep lab and the medical director for the Crafton Hills College Respiratory Care Program. Okay, Dr. Seheult has also won a whole bunch of awards, which I won't list, and he teaches online at MedCram. He is also a supremely lovely person, and I had a delightful time talking with him. His 8 pillars of health are beautiful, and you can see why they have carried him so far in his career and made him such a pioneering and curious doctor. So enjoy my conversation with Dr. Seheult. And of course, please remember, we like to get as much sunlight outside as possible during the day, and we like to block artificial light at night. If you're around lights or screens at night, you really need a pair of blue blockers. Our brand partner, Bon Charge, has some very cute ones, and they're also very high quality. They also offer our listeners a very nice 15% discount. QBC at checkout. So just enter QBC into the little box when you check out of their page at boncharge.com. The link is in the show notes, but all you need to remember is stick QBC in the box. All right, enjoy my conversation with Dr. Seheult. Dr. Roger Seheult, thank you so much for coming on the QBC podcast. I'm so excited to talk to you. You are a person who does all the things. You work as a doctor, you teach clinically, and you have an amazing website called MedCram. So for people who don't know what that is, I'd love to just start with that, because your specialty and your great, I think, sort of service to the world has been to understand that people need things explained clearly in order to effectively do them. So tell us a little just quickly what MedCram is and how that came into your world.
Sure. Well, thanks, first of all, Meredith, for inviting me onto the podcast. Really appreciate it. So I'm a physician. I treat patients with issues with their lungs. I'm also working in the hospital in the critical care unit, and I teach students. And so about 12, 14 years ago, I had a student, a PA student, who joined me, and he had a great idea that my teaching style would be very conducive to teaching other students things about medicine. So we came up with an idea, a website called MedCram, where we basically go over very complicated topics and we make them very easy and understandable. And of course, we used a public platform to do this, to reach as many people as we possibly could. And in the process of that, we also collected a wider audience of people who maybe not are students in the medical field, but want to learn anyway about diseases and disease processes that they or a loved one might have.
I think it's just a fabulous offer because, yeah, you go into these multi-year educational processes and then you come out the other end, and one day you need to have deep clarity on a specific thing you learned 4 years ago, maybe, and so to have that resource, I think that's really important in the future of education, and something that we try to do for our area as well. It's like if it's not clear, if we can't understand it, we can't apply it, and then it's not useful to anybody.
Exactly.
Okay, so tell me, you work in the ER. You have multiple specialties, including board certified sleep doctor, which is obviously really important to circadian rhythms. How did you come to discover the importance of sunlight?
Yeah, that's a really interesting question. So, when this thing called COVID-19 hit, and it started to be like a wave over this country, I had sort of an interesting thought in my mind because I had gone into pulmonary disease, and obviously that's a pulmonary disease question. So I became very, very involved in trying to figure out how best to treat COVID. In fact, our MedCram channel started to do these COVID updates at the very beginning. And so we didn't have much, as you remember, in the early part of 2020, and people were dying in the hospital. So we were looking for just about anything, whether it was off-label or supplemental or anything like that. And you may remember that one of the things that popped up very early on in the studies showed that people who had higher levels of vitamin D seemed to do better in the hospital. And that's still the case, and that's undisputed, is that people with higher levels of vitamin D don't seem to have to go to the hospital as much. When they do go to the hospital, they seem to do better and they're discharged home. And so one of the things that I did, and I still do, is supplement with vitamin D and make sure patients are getting vitamin D. But I was disappointed, a little bit disappointed, when they started to do not the retrospective data to say, hey, look, these people with high vitamin D levels seem to do better. That's one thing. That's a retrospective association type of study. But what I thought I would see in the prospective studies a much better result of vitamin D supplementation in those patients. And there were some studies that did show a benefit with vitamin D, but there were a lot of studies that didn't show a benefit. And that may be because of, the timing of supplementation, how vitamin D needs to be processed. Obviously, vitamin D is something that has to be hydroxylated in the liver and the kidney. It has to be in the active form. But I began to think about the real possibility that maybe the sun is doing something more than just giving us vitamin D in our skin, that maybe vitamin D isn't doing the heavy lifting. Maybe vitamin D is a marker, in addition to being something obviously that has effect, right? There's no question that vitamin D has an effect on the human body. But is it possible that sunlight is doing something more than vitamin D, and that vitamin D in these COVID patients in the hospital is simply a marker of people who had gotten that sunlight, and maybe there's something else that is potentially benefiting these COVID patients? And so I began to study, look, and I found quite a bit of studies and evidence that seems to show, in fact, and this is what my current belief is that that the sun and sunlight gives us much more benefit than just vitamin D. Vitamin D is just one aspect. And if you were to think, I think it would be a mistake if someone were to think that just taking a vitamin D supplement is going to fulfill all of the benefits that one might get from the sun.
Thank you. And I just want to say here, thank you for being a good doctor. Right? Noticing these things and saying, hey, wait a minute. I think there's something more going on than what I was told. Let me investigate it and see what I find.
Yeah.
That is a gift. Thank you for doing that. So what you found was that there is actually sufficient credible research to point you in the direction of using sun therapeutically, and that there may be more benefits to the sun beyond just raising our vitamin D, because people who raise their vitamin D with supplements weren't showing the same outcomes. Is that
Correct?
Okay?
Correct. That's exactly right.
So what was the next step? So we were like, okay, wait a minute. The sun has benefits beyond just what we were told. Then what happens?
Yeah. So you know how it is. There is the stuff that you know that you know. There's the stuff that you know that you don't know, and there's the stuff that you don't know that you don't know. So the very first thing that I did was I went to the internet and I just searched PubMed for all of these peer-reviewed articles and things that have been published on this, because we live in an age where there's just so much information, so much good, credible information, that the real rate limiting step in our understanding is being able to process it, find it, look at it, read it, understand it, and then go from there. And what I found is a plethora of very good quality studies that all seem to point towards and indicate that there are components of sunlight, specifically in the near infrared spectrum, that have a tremendous effect on our body, that can penetrate through our skin deep into the actual core of our body, and actually affect changes that can change not only our ability to fight infections, but also have a great effect towards our metabolic health. And there are studies out there that show this very clearly, maybe not in a randomized placebo-controlled way, but in very good evidence way and in a dose-dependent way. And then if you look historically at how sunlight has affected people and how sun has been used by people, you put it all together, it's a very compelling argument.
Yes, and we've certainly seen that. I mean, over the last sort of 5 or 6 years, have been connected with a lot of people, including myself and my family, who have come to this conclusion and made sunlight a daily part of their lives. And I don't know anyone who didn't see positive benefit from it. Like, nobody who makes that switch, unless they don't really know what they're doing and they fly to Mexico and lie out in the sun at noon after being in Minnesota in February or something. But
that's the problem.
Barring that,
yes,
just the practice of going outside where you live on a regular basis. I have not seen anybody who didn't have significant improvements to their life from doing that.
Absolutely, yeah.
Anecdotally speaking.
Right, and in terms of the studies, the one that really piqued my interest early on in looking at this was a study that was done out of the University of Edinburgh, and they looked at the United States, they looked at the UK, and they looked at Italy. And in this study, they looked at specifically COVID-19 patients and mortality rates in COVID-19 patients. And they did it during the winter time. So obviously in the Northern Hemisphere, in the winter time, the sun, for most of that extreme Northern Hemisphere, isn't going to have enough UVB light to produce vitamin D. And so they looked specifically at those places that were not getting any of that UVB, so that vitamin D was no longer even a factor in determining. So the production of vitamin D was not a factor in that study. Yet it still showed in that study that the higher in latitude you went, that the worse the mortality rate in COVID-19 was. And what they showed was that there was something else in sunlight other than UVB making vitamin D that was predicting the mortality in COVID-19 patients. Another study that was done this time in Europe looked at the autumn 2020 surge of COVID-19. And what they showed was that when they looked at all of the countries of Europe, that it wasn't humidity that determined when they would get their surge of COVID-19 in the autumn of 2020. And it wasn't temperature that caused it either. What it was simply latitude. So what you saw was the very first country to get the COVID-19 surge was Finland. And from there, it was a bunch of countries going down the list. Finally, the last one to get the COVID-19 surge was Greece. And it showed a very nice correlation that seemed to show that latitude, once again, which is something that, of course, that is tied to sunlight, had the most major impact in that. And so I started to understand that, yes, there's something about sunlight other than vitamin D that is having a major impact in COVID-19 mortality and outcomes. Why would that be? What I had already discovered and what I'd already learned was that COVID-19 in this case, and what I'm saying COVID-19 over and over again here, this can be generalized to just about any infectious disease, but we'll talk about that. Specifically in COVID-19 and SARS-CoV-2, when the SARS-CoV-2 virus, and it's even more particular with SARS-CoV-2, when it infects the cell, it disrupts the ability of that cell to balance oxidative stress. So I don't know if we've talked about oxidative stress on your podcast, but oxidative stress is one of the major contributing factors in most of the diseases that we see in Western culture, whether it's diabetes, hypertension, heart disease. All of those things are related to and tied to mitochondrial dysfunction and oxidative stress. As many of you know, the mitochondria is the powerhouse of the cell. It is where we produce ATP, which is the currency of energy for the cell. Imagine it's like an engine, okay? An engine, a regular internal combustion engine in your car. This is the part of the car that allows your car to drive. It gives power to the wheels, but it also creates heat. Heat is that oxidative stress. And if you don't deal with the heat that's coming from the engine with a cooling system, then you're going to have the engine shut down. And it's the same sort of thing that happens in the mitochondria. The mitochondria produces this energy, but in the process of doing it, it has to transfer electrons onto oxygen to make water. And if that doesn't happen in just the right way, you can make these oxygen radicals, things like superoxide, like hydroxy radicals, like hydrogen peroxide. These are things which the body can use to fight infections in certain ways, but it can also damage the mitochondria. And if that damages the mitochondria, that builds up oxidative stress, and that can damage the cell and leave you open to all sorts of these diseases. So what happens with COVID-19 is when the virus infects that cell, it knocks out ACE2. ACE2 is the receptor for SARS-CoV-2. We have all heard that. What we haven't maybe understood universally that we should is that ACE2 is a major enzyme in the regulation of oxidative stress. And so when that virus knocks out the ACE2, you now have turned the needle from wherever you were, existing before. Let's say you were just sort of putting along. Let's say your engine was running a little hot, but it wasn't overheating. And now all of a sudden you get a SARS-CoV-2 infection. Now, instead of just getting along and your engine's running a little hot, you're now going up a hill. And now you're going to have an engine overheat. Your cell is going to shut down. And this is the issue that we have, not just with COVID-19, but also with just about any other viral infection that we can show. Now, here's the thing. Here's how this comes into and ties into what is it about sunlight that could be improving outcomes in COVID-19 that has nothing to do with vitamin D. As it turns out, and this is where we come to Scott Zimmerman and Russell Ryder's paper, who I know that you're going to have on your show at some point. That infrared light, which is a very specific component of sunlight, and we could talk about the characteristics of near infrared light. It's actually a very interesting discussion. But nevertheless, infrared light, and we haven't worked out exactly how this is doing it. We have some theories, but infrared light has a dramatic impact on the regulation of oxidative stress in cells, specifically related to the mitochondria.
Wow. This is hugely important to understand, because my understanding is that just being outside, no matter what the season, no matter what the time of day, as long as the sun is out, there is infrared light present. And that infrared light, you're saying, is a critical ingredient to human health.
Yes, absolutely. So let's talk about the characteristics of infrared light. Over 53% of the photons coming from the sun, when I say photons, these are particles of packets of light. Over 53% of the photons coming from the sun at any given time, just on average, is in the infrared spectrum. A small percentage of the energy coming from the sun is in the visible spectrum, and even smaller amounts is in the ultraviolet. And so what I can say pretty safely is that the majority of the light coming from the sun is in the infrared. Now, have you ever pulled up to a stop sign and there's some people in another car next to you, and they're playing that really loud music? What do you hear in your car? You hear the boom, boom, right? You hear that low frequency sound. And why is that? That's because low frequency energy can penetrate through solid objects much more easily than the higher frequency energy. So you're not hearing the high pitched sounds. You're not maybe hearing the voice or the melody. All you're hearing is the underlying boom, boom. That's the same way with sunlight. Imagine now the sun is giving off all sorts of frequencies of light, and then it comes to the atmosphere. So ultraviolet is a very high frequency energy. It's actually where most of the damaging rays of the sun are. It's in the ultraviolet section because there's a lot of ionizing radiation. The majority of ionizing radiation from the sun is in the ultraviolet area. We know that ultraviolet A is damaging to skin. But there's ways that the skin has of protecting against that. We'll talk about that. And then you have visible light, which is a little bit lower in energy, and that can come through fairly well. And then finally at the end, what we have is infrared light. So think about this. When the sun is very low in the sky, it has to penetrate through a much longer path to get to your body. It has to go through more atmosphere than when it's directly overhead at noontime, because it's directly penetrating through the atmosphere. It's a shorter distance. You understand this when you realize that when the sun is going down in the evening and it's sunset, what typical colors are we seeing? It's the reds. It's the deep, right? And that's because it's harder for that higher frequency light like the blues to come through that. So the point is that no matter where that sun is, whether it's low in the morning, right overhead, or setting in the evening, there is plenty of near infrared coming through that whole time, because near infrared has no problem passing through the atmosphere to get to your body. Now, it's not just that. Near infrared radiation has no problem penetrating through your clothes. Okay, so you're wearing 1 or 2 layers of cotton or polyester, whatever it is that you're wearing, or a combination. We actually have some studies that I was able to find that shows that 1 or 2 layers of clothing is not going to stop. So it has no problem penetrating through your clothes. Hold on, we got more. There's more.
That's so cool. Okay.
It has no
All right.
problem. It has no problem penetrating through your skin. Okay.
Right.
In fact, this paper, which I'll be referencing quite a bit today, is Scott Zimmerman and Russell Ryder's paper that was published in Melatonin Research back in, I want to say 2019.
Okay.
And he shows that, and this is mind-blowing stuff, what we're going to talk about here, is that your body is actually designed in a way to capture that infrared light and to spread it and diffuse it throughout your entire body so that it can be utilized by the mitochondria in your cells. So again, this is a completely different paradigm of what we're thinking about. Sun only affects skin. It doesn't, okay? To give you an example of how this is possible. First of all, I know that people are already listening to this and they're saying, how is it possible that light can penetrate through your body? So I had the privilege of meeting up and talking with, and actually having on our podcast, Bob Fosbury, who is a astroscientist.
Oh yeah, we listened to Bob.
Yeah. So
he's delightful.
you need to have Bob on your podcast
Well,
too.
I would love to. I reached out to him. I haven't heard back.
Okay. So he sent me a picture of his hand with a near infrared, and it's out there. It's on my Twitter account. If you search, you'll see it. Bob Fosbury, and you type in @RogerSchwelt on Twitter, or on X, I guess they call it now. And he shows this light right behind his hand. And it's basically, the light just comes right through the hand. Now, you'd say, well, maybe I should be able to see the outline of bones.
Yeah.
This is mind-blowing. No, because the light goes right at that frequency of light. Bones do not stop that type of frequency. Okay?
Whoa!
It just goes right through.
Okay.
Okay, so this is, and Scott Zimmerman even shows this. Okay, this is even more mind-blowing, literally. Okay, because this type of light, which very low frequency light. Okay, again, think of the boom, boom. It's penetrating through metal. It's penetrating through we're talking about the sound now. You're at the car. You're at the stop sign. Think about what those speakers are penetrating not only their car, but your car, and shaking your steering wheel. Okay? That's that type of low frequency sound, and what it can do is just amazing. Here we go. That type of light penetrates the skull. Okay? You've got a hat on. It'll penetrate the hat. It'll penetrate the skull. The first layer it encounters is the cerebral spinal fluid, which completely encirculates the brain. Okay? That diffuses it. So if light's coming on this side, that water, that cerebral spinal fluid, which is the same consistency as water, will diffuse that light all the way around the brain. Okay? And then if you've ever seen a brain, you'll notice that there are something called sulci and gyri. It looks like a walnut. Okay? There's ridges. So if you actually look at those ridges, and Scott Zimmerman, who is a light engineer who understands these things, says that the surface of the brain is engineered in the structure of the surface. We're not talking about the neurons, just the way it looks, is exactly the same way that engineers design airplanes to evade radar. And how it does it is that it does it in a way that whenever the light will hit it, it will be deflected to its interior to absorb that light. And so what you have are these valleys and troughs. When the light hits it, it goes down, disappears, is absorbed, and the area around the surface of the brain is the gray matter. What do I mean by gray matter? It's the area where the bodies of the neurons is on the outside of the brain, whereas the white matter, which is the myelin, which is the transmission, it's the cords, is in the center of the brain. And so where is mitochondria the richest? In the white matter or in the gray matter? It's in the gray matter. Okay? So in other words, what you have here is you have a solar system array. The brain is actually designed in a way that it maximizes the ability for infrared light to get to the second highest concentration of mitochondria in the body, which is in the gray matter of the brain. Actually, the highest concentration of mitochondria is in the eye. We'll talk about that hopefully in another point. But the point is that this infrared light is everywhere. It's outside. We have more to talk about there. But already we start to see the way that the body is designed is that it is designed to maximize that light's effect to get to the area that it's needed the most, which is the mitochondria.
This is incredible. Thank you for that excellent articulation. So our brains are designed to absorb infrared light in order to maximize our mitochondria, which drives metabolic health.
Yeah, in the brain, all over the body. Glenn Jeffries, who's also works with Bob Fosbury at the University College London, has done some experiments, randomized controlled trials, just published actually, that showed that light exposed to people, so in a randomized placebo-controlled fashion, that red light, infrared light, that spectrum again, reduced blood sugar and showed signs that basically it improved over a long period of time, it would improve diabetes. It's amazing stuff. There was a study that was done in Oxford, at Oxford and in Leiden. So Leiden is a city in the Netherlands. And of course, Oxfordshire's in London. It's where Oxford University is. And they did a very simple experiment. Very simple experiment, but it showed a lot. They simply drew blood from a number of thousands of patients. Blood specifically looking at cholesterol, triglycerides, and also measuring insulin sensitivity. So these are all the things that are associated with metabolic health. And then what they did was they looked throughout the year, whenever these people had their blood drawn, they looked at the previous 7 days and went online and found the weather report and looked at how much sunlight there was in the previous 7 days. Okay. So, and they just correlated it. And what they found was that just within 7 days, okay, so this is not something that takes years for this to, just within 7 days, they found that the more light, the more sunlight, the more days of sunlight that there were in those 7 days, the better the cholesterol levels, the better the triglyceride levels, and the better the insulin sensitivity was in those patients.
This is so amazing because it really shatters our paradigm of how we think we need to manage our health, which is like purely through food and diet and exercise, right? Like what you're saying is we can spike our blood sugar with bad light and we can lower it with good light. We can manage all of these different responses with light.
It's one I call it the 8 pillars of health. Sunlight is one of the 8 pillars of health. And what are the 8 pillars of health? It's actually really easy to remember it because the mnemonic is new start. Okay, so nice. N is nutrition, E is exercise, W is water. I'd be happy to talk to you about not only the internal effects of water, but also the external effects of water. So we're talking about hydrotherapy. These have very scientifically proven, shown effects on the human body. Start, so that's new. Let's go to start. S obviously stands for sunlight. So yes, this is one of the things that we're talking about today. But let's round out the rest of them. T, temperance. It's kind of an old term that we used to use for avoiding toxins in our body. So cigarettes, alcohol, things of that nature. A, air, fresh air. Cannot understate the effects on the human body to just fresh air. And it's not air that is devoid of substances other than oxygen and nitrogen, but it is air if you're going out into nature, there are actually proven scientifically, substances that come off of living organisms like trees that can have an actual beneficial effect on our immunity. And so that is another very specific component and pillar of good health. The R is rest. So everybody needs rest. So we talk about sleep, both a daily rest, and let me also just throw in there's emerging scientific research that shows a weekly rest is also very beneficial as well. And then finally, that last T is trust in a higher power. This used to be a very soft aspect of health, but we are getting very good data that shows that, if we go through life trying to shoulder all of the stress and things on our own, that can have a negative impact. And so having a community that you can talk to and be with and be a part of is a really important. It's been shown in blue zone studies that to be actually very important. So those are the 8 pillars. Today we're talking about sunlight. Yeah, it's not just nutrition, but definitely sunlight is very, very important. Let me just mention to you why I believe this is becoming an acute issue. We talk about why is it that we have such a explosion of obesity, diabetes, hypertension in the United States. And a lot of people have talked about nutrition as a potential reason, and processed foods. And of course, that who can deny that that is not the case? But there's also emerging evidence that might also implicate light as a reason for that. And let me explain why that's the case. If you look, and again, I got this a lot of this data from Scott Zimmerman's paper as well. If you look at our behavior in the United States over the last 200 years, you will see a definite and almost deliberate reduction of near infrared light in our lives over the last 200 years. We used to be much more outdoors than we used to be. And that's just because of technology and money, right? Today, we are able to leave our home, go to our garage, get into our vehicle, drive to a parking structure at work, which is covered, go into an elevator up to our office, spend the entire day in that office, in an environment, by the way, where we work in an environment where the windows are specifically designed now to block infrared light. Why is that? Because infrared light, it provides the warmth of sun. So let's just back up a little bit. I can prove to you, or you can prove to yourself, that infrared light penetrates through your body. Just go out on a warm summer day, and when the sun is out, close your eyes and see if you can tell where the sun is just by feeling where the sun is. That feeling is actually the infrared light penetrating your clothes, going into your skin, and activating the heat receptors deep in your skin. It doesn't stop there, it keeps going, but you can feel that. If we were to put regular windows in your office building, that sunlight coming in would act as a greenhouse gas or greenhouse effect, and it would tremendously heat up the building, and it would cause them to have to use a lot of energy to air condition and cool down that building. And so we have today something called low E glass. And in places like where I live in California, it's code. You have to put these windows in. And so when you are inside and you think that you open the window and you're getting all of this light in, it's actually light that is specifically devoid of this exact type of light that we're talking about, which is near infrared light. Hold on, we got more though, because 30 years ago, we would have regular incandescent Thomas Edison light bulbs. And these light bulbs, like the sun, would give off most of their energy in the infrared spectrum. In fact, that's why it costs so much electricity to run these incandescent bulbs, is because the majority of the energy was being used to generate light that you couldn't even see. And so this was deemed as wasteful. We were using electricity to generate light that you could not see. And here's this very narrow visible spectrum. So the answer to that was LEDs. So LEDs now have flicker so that it can, sometimes it causes headaches and things of that nature. But now LEDs are designed to only use electricity to produce only visible light. There is no ultraviolet light that is produced, and there is no infrared light that is produced. So think about this now. 1800s, you would travel outside. There was no garage. You would be walking outside. You would be on horses. You would be in the grain fields of Kansas. There was farmers outside. People were exercising more. People were getting outside. Now what do we have? We have computer jobs. We have desk jobs. We have office jobs. We are exchanging data, communications, banking. We have a lot more service jobs, hospitals, buildings. We drive in our cars, which are enclosed. We go to the parking structure, which is enclosed. We go up the elevator. We go into our office, which has windows that block out infrared light. We have light that's coming down from the ceiling, which is devoid of infrared light. We work late. We come home to our car. And you see where I'm going with this, right? And then we've gotten no infrared light all day. And now we come home, and what is our culture? Our culture is to entertain ourselves and to relax and unwind with a late TV dinner and putting on the television at night, exactly when we really should be expressing darkness so that we can produce melatonin. By the way.
So yeah, we have inadvertently created the most health destructive environment possible.
From
And
a
then
life
we wonder
standpoint.
why the chronic illness epidemic is so
So let
robust.
me tie this all together with melatonin. Okay, because melatonin is the coolant in the overheating engine. Okay, so
Okay.
we have oxidative stress, and oxidative stress is the heat in the engine, and our engine is the mitochondria. What is it that we can do to cool down that engine, to allow that engine to regenerate, to produce the energy that it needs, and to minimize our effects of diabetes, hypertension, all of these things, obesity? And it's not as simple as I'm putting it forth. There's a little bit more complexity, but I can explain it very well if I use melatonin. We've known this for years. This is not new, that melatonin is produced by the pineal gland at night when no light is being exposed to the retina. Okay, so let's just review that once more. If after 9 o'clock at night, well, normally based on our circadian rhythm, melatonin is that hormone of darkness that comes on right before you go to bed. It's produced by the pineal gland. It goes throughout the entire body, and it's a signaling mechanism to your body to say it's time to shut down. Now, if you have light coming into your eyes at 9 o'clock p.m., and I'm just giving that sort of that general time period, it's going to hit the retinal ganglion, sensitive retinal ganglion cells, and it is going to go to the suprachiasmatic nucleus, which is a little area in the back of the brain, center of the brain, and then that will then shut down the neurons that go to the pineal gland that tell it to make melatonin. So you will shut down melatonin, okay? We know that people who stay up late, expose their eyes to bright light, have circadian dysregulation, they have more diseases, cancers, things of this nature that are related to less melatonin at night. So, how does the body mitigate oxidative stress at night? It does it through melatonin production. So, what should we do at night to maximize the benefits of melatonin? We should attempt to limit our eyes to light after 9 o'clock. Now, what I've just described to you has been the thinking, is the thinking, and is correct. But here's the kicker now. We're now learning that melatonin mechanism that I'm just telling you about represents less than 5% of the total body melatonin production. Okay? So this has been, like, when I say melatonin, it's synonymous with circadian rhythm. It's synonymous with nighttime. It's synonymous with all of those good things that happen at night. And I'm not taking away anything from that. But what I am saying is that it represents...
because that is most people's association is melatonin. I take it to go to sleep when I have jet lag, or, it's the sleepy time. It's the sleep hormone. It's the sleep hormone.
Exactly.
So what you're saying is, yes, it is the sleep hormone, the pineal melatonin.
Yes.
However.
So this is the thing that I want to make very clear, is that the pineal gland uses the body's circulatory system, the blood system, to distribute that melatonin throughout the body, because that melatonin is secreted by the pineal gland. It then goes into the circulation system, and then it gets picked up by the cells and goes into the cell. Okay? That's less than 5% of what's going on in the body in terms of melatonin. Here's the mind-blowing thing. And we haven't quite connected this yet, but this is what I'll tell you what we know, and I'll tell you what we are theorizing. What we know right now, we know this based on biochemical, very high quality studies, is that melatonin, in orders of magnitude greater than we see coming from the pineal gland, is actually produced on site in the mitochondria itself. Okay? So in other words, the mitochondria has within itself, the mitochondria are these little organelles inside all of your cells except for red blood cells. The mitochondria have the cellular mechanisms, the enzymes, to take the amino acids that are required, okay, tyrosine, to make melatonin on site. Now, Scott Zimmerman, Russell Ryder, they theorize, this is based on a number of studies that look at this. They haven't quite worked out this 100% yet, but what they are saying and what they are hypothesizing and what they believe based on the evidence is that one of the major stimulants to the mitochondria producing melatonin is near infrared radiation. So, how do you prevent oxidative stress at night? It is by limiting light exposure to the eyes at night. Question: how do you maximize melatonin-mediated protection of the mitochondria during the day? It is through the production of melatonin on site in the mitochondria through the pathway of infrared light exposure. Now, why is this important? This is why is this is important? This is important to understand the difference between these two, is because the type of melatonin during the day does not get into the blood. It stays right where it is. It's like having a cooling system in the engine itself. Now, why is that important? Because melatonin is a signal to the body that it's time for sleep. You would not want to have melatonin circulating in the blood during the day because it would confuse the body.
Yeah, you'd just be falling asleep
Right.
at your desk or wherever.
Now,
Okay.
let me tell you briefly, melatonin is it's the most powerful antioxidant substance that we know of in the human body. It's more powerful than glutathione. It actually has 4 different areas on its molecule that will neutralize oxidative products. Melatonin actually upregulates the glutathione system itself. So melatonin is like the king of antioxidants. And one of the things that we are understanding that considerably boosts that is near infrared radiation. So again, one of the things that really made me convinced about the use of near infrared radiation in people like COVID-19. What would happen if we took people with COVID-19 and we blasted them with near infrared radiation? What would happen? Because here's what I believe happens in people with COVID-19 very briefly. As we said, the SARS-CoV-2 virus binds to the receptor, shuts down the ACE2. Now the balance in the cell of oxidative stress has gone from barely hanging on in some of these patients that are susceptible to dying. And who are those people, by the way, that are susceptible to dying in COVID-19? All of the people that have difficulty with oxidative stress. Obesity is a risk factor for COVID-19 mortality. Age is a risk factor for COVID-19 mortality. Diabetes, hypertension, cardiovascular, all of these things, if you look at oxidative stress in these patient populations, it's off the charts. And so these people are barely hanging on, and now they get this nasty virus, which takes them out of just barely hanging on to no way are they going to be able to make it up the hill. The engine is going to overheat, it's going to shut down, it's going to seize, and the engine's dead. And unfortunately, a lot of these people died as a result of that. So what happens? How do they die? The cells become damaged, and it's the cells specifically in the pulmonary vasculature. Okay, these cells in the pulmonary vasculature, again, here you have the endothelial cells, which are the first layer in the blood vessels in the pulmonary circulation, and they prevent the blood that's circulating from seeing any of these antigens over here under the surface. Why is that important? Because if the endothelial cell were to become exposed or to open up and expose the bottom part, you would immediately get a blood clot. That's how blood clots form, is whenever you see tissue exposed to the blood will immediately clot. The thing that prevents blood clotting is the smooth endothelial surface. So you need to have a smooth endothelial surface to allow the blood to keep flowing. So what happens is that this smooth endothelial cell gets infected with SARS-CoV-2. It then causes an oxidative stress in that cell to the point where the cell dies. And when it dies, it exposes underneath it all of this antigenic substances, which then cause the blood clot. And you get these micro clots all throughout the vasculature. And that's how you get the happy hypoxics that we learned about in 2020. And these are how these people end up on ventilators and then they die. So the key here is preventing the oxidative stress in the first place, or at least preventing the progression of oxidative stress. Well, we just said that near infrared light can penetrate through, specifically in the lungs is where we need it, and it can produce melatonin, which is the super king of antioxidants. So there was a study that was done. Okay, get ready for this, all right?
Okay.
All right.
All right.
So here, this is all nice theory, right? But let's actually see, does it actually work, right? Okay, so there was this, and when I saw this, I knew that this was correct. Unfortunately, by the time I saw this study, most of the patients that I had seen as a clinician in the hospital dying of COVID had already passed, and the numbers were coming down dramatically. And so I wasn't able, in the majority of my patients, but I did in a few, which I'll talk about here. I wasn't able to actually put this into implementation. But this study, this was a Brazilian study. I don't know how these guys thought about this, but it's an amazing study. So what they did was they actually created a jacket. Okay? This was a jacket, and on the inside of this jacket were LED lights. Okay. Now, these were not the LED lights that we've talked about that do not produce any infrared light. That's just visible light. No, in fact, these were LED lights that were specifically designed to only emit infrared lights. Okay.
Okay.
Specifically,
so like a red light therapy jacket.
Yes, exactly.
Okay.
Except it wasn't even red lights, because you can see red lights.
Oh,
this was even beyond that. This was 940 nanometers. So we can see up to about 760, give or take.
Right.
And then this is the same frequency.
It's like when you order a red light panel, some of them you don't see because
Correct.
that's
exactly
post visibility. Okay.
The best way I can explain it is if you have a remote control for your TV, that actually uses this kind of frequency. It's an infrared. If you were to press the button and look at the thing, you would not see it flickering. But actually, by the way, if you use an iPhone and do the same thing, the iPhone camera kind of goes a little bit into that spectrum, and you will see it flicker on the iPhone, but not with your naked eye. It's kind of interesting.
Oh, interesting.
Yeah. So
so the Brazilians made a jacket just of infrared light.
That's correct. And so you could switch it on, but you wouldn't be able to see that it's on with your naked eye. Okay. So a bunch of LEDs. So they put this jacket on. Okay. And they took into their study people who were sick enough to be admitted to the hospital, but not sick enough that they needed to go on the ventilator. That was their population of people. They had a certain.
And these are all COVID-19 patients.
These are all COVID-19 patients being admitted to the hospital.
So too sick to be at home, but not needing ventilators.
Exactly. So this is the majority of patients that we would want to be helping, right? Right. So what they did was they put the jackets on to people, and they did not tell the people or the people taking care of these patients whether they were in one of the branches or the other branch of the study. So in other words, it was a double-blinded placebo-controlled trial. Okay. The patients couldn't tell because they can't see if the lights are on or not. Right. It's invisible. But they had one person who knew who was supposed to be, and they would just basically switch it on or they would switch it off. So the only difference between the intervention group and the control group was the jacket was turned on or the jacket was turned off. That was it. Okay. And they did this for 15 minutes, just 15 minutes a day. That was it for 7 days. Wow. Because I'll just tell you, they measured what were the outcomes. First of all, they measured how fast did the patients get discharged, because they did not power it for mortality, because we're talking about 30 patients that were in the trial. There's no way that's powered to see mortality difference, because the case fatality rate for COVID-19 was less than 1%. So you're not going to be able to see a difference. So what they wanted to see was what happened to lung function, what happened to the white blood cells, and what happened to how fast they got better, what happened to how fast the oxygenation improved, what happened to how fast they got out of the hospital. All right, so just let me give you a little bit of idea about hospitalization. We give people Tamiflu for their influenza, correct? What got Tamiflu FDA approved for influenza was the fact that it cut symptoms short by 24 hours. Okay? Not hospitalization, just symptoms. In other words, your symptoms lasted for 5 days instead of 6 days. That got FDA approval for Tamiflu. Okay?
Okay.
This jacket that they put on people cut hospitalization days. When you are hospitalized, that's like $1,000, $2,000 a day. Okay?
Okay. Yeah.
Cut hospitalization by 4 days. In other words, these patients in the intervention group were out of the hospital 4 days earlier. Now, that wasn't just by chance. There were reasons why they got out of the hospital 4 days earlier, because number one, their oxygenation got better faster. Their white blood cells came up faster, and their pulmonary function tests were superior in the intervention group. And these were statistically beyond statistical significance, like 0.0000. In other words, there's no question. There's no way that the differences that they saw between these two groups were by chance alone. There was something that happened in these. And in fact, if you look,
15 minutes a day in the infrared jacket.
Correct.
Their scores were better across the board.
Correct. And this is consistent with what Glenn Jeffries found in terms of the red light and his diabetes patients. He says he doesn't understand exactly what is going on in the mitochondria. There's a number of proteins that are receptive to light, but he feels like there's a certain minimum amount of time that is required. And then after that, it doesn't seem to do as much. So in other words, there's a certain amount of light that is necessary. And then after that, you've already gotten the benefits of whatever's going to happen. There's been a state change that has occurred in the system that is now going to cause improvement. Okay, so I knew at that point we were dealing with something there. And here it is that 940 nanometers is one particular wavelength. The sun has all of those wavelengths, okay? So it's not like you have to try to guess which wavelength it is. So I started doing research. And I started going back to the last pandemic. Okay, so this is the stuff that you never hear about. So before antibiotics, before the FDA, and let me just tell you, I am not against using pharmaceutical things when we need to. I work in an intensive care unit. I have saved many patients' lives by putting them on antibiotics, vasopressors to pull them from the jaws of death. But I don't leave them there. When I discharge them, I tell them about lifestyle things and things that they ought to do. So I'm not against that stuff. But let's just go back to the pandemic of 1918 in the United States. And let me set up a little bit for you what happened during that period of time and what I found out what happened during that period of time. And this will, then you'll start to realize that maybe we've forgotten some of the things that we used to do, and that maybe we should start doing these things again instead of ignoring them completely. Before FDA was doing randomized placebo-controlled drug trials, before we had antibiotics, what did we do? What were the dichotomy? So 1918 pandemic, Spanish flu, it was called. The servicemen were coming back from the war, which they had just won, and this pandemic was just starting up. They came back to the army camps in the United States, and the flu was just horrendous. This, unlike COVID, actually hit a lot of the young people for some reason. A lot of the young people were dying as a result of this. Aspirin had just been invented or discovered by a German pharmaceutical company called Bayer, still around, 1899. The symptoms of the flu were fever, body aches. And the physicians, the best physicians in the world in our army camps at the time, believed that this was what was killing people. It was the high fevers, it was the muscle aches, it was all of this stuff. And lo and behold, aspirin mitigated all of this stuff. So what were they doing in the army camps? They were giving them high doses of aspirin, thinking that this would improve it. Their case fatality rate was about 6%. Okay, so
Wow.
six
Oh my
times more
gosh.
deadly. Yeah, 6 times more deadly than COVID is the type of outcomes that they were getting in the army camps in 1918. Okay, so I dug and I dug and I dug, and I found this doctor by the name of Wells Rubel. Wells Rubel, this is when he was the medical director of something called the New England Sanitarium. This was in around Boston. And this sanitarium had a different philosophy. So let me give you a little bit of a background. This was an Adventist sanitarium. It was part of a network of other sanitariums in the Northeast, about 10 of them. And they were dialed into a different way of treating patients. If you understand the history of the Battle Creek Sanitarium, of John Harvey Kellogg and some of his research, and he actually went to Europe to discover about light and what they were doing with light and sunlight at high altitude in these tuberculosis sanitariums, and the types of amazing cures that they were getting for people. Again, remember, this is before antibiotics. This is before therapeutic intervention like rifampin, isoniazid. This is the standard that we use today. They had none of that. And yet they were getting 80% cures of tuberculosis in these high altitude sanitariums. Well, John Harvey Kellogg could not do that in Battle Creek. Battle Creek was, what's the altitude of Battle Creek, Michigan? It's not even 1,000 feet, right? So at those high altitudes, you had a very good environment for the curing of tuberculosis, because tuberculosis loves oxygen, and there's hardly any oxygen at that altitude. It loves, tuberculosis hates ultraviolet radiation. And at that altitude, ultraviolet radiation is very abundant because there's very little atmosphere to block the ultraviolet radiation from the sun. And so what John Harvey Kellogg did was he tried to adopt a lot of the principles at Battle Creek. And one of the things that he knew was very important was sunlight. So ultraviolet, infrared, all of these things. And he actually designed light boxes that people could go into. I mean, if you go today to Battle Creek, you'll actually see the John Harvey Kellogg Museum and all of these devices. The man was decades ahead of his time. Nevertheless, out of this culture and this understanding of the things that I've mentioned, New Start, nutrition, exercise, water, sunlight, trust, air, all of these things, that Wells Rubel believed that their method of treating the Spanish flu was superior. And so he actually looked at a cohort of patients that were admitted to their sanitariums over the same period of time that were at the army hospitals, whereas 6% were dying in the army hospitals, less than 1% in his sanitariums were dying because of what they were doing. What they were doing was they're getting patients out into the sun. And there's actually an article where he actually describes this. They were doing hydrotherapy on them. They were having them rest. They were not using any aspirin products whatsoever. So they were not bringing down the fever, which we now know today is actually a defense mechanism of the human body to override the virus. So increased fevers increases interferon. Interferon is one of those things that actually attacks the virus. And so I began to see that we understood, some of the top scientists in the world 100 years ago, 150 years ago, understood that there were things that we could do from nature to enhance our own body's ability to help fight these things. Now, nothing is 100%. I would never recommend as a physician today to say, do this to the exclusion of anything else. Obviously, it's a Swiss cheese model. You want to do, when I say Swiss cheese, it's got multiple holes. Every slice of cheese has holes in it where it doesn't perform 100%. So by putting multiple slices of Swiss cheese, the holes of some will line up with the solids of others, and you'll get a much more robust mechanism. So
we need the sunlight Swiss cheese slice.
We do
in our pile.
Absolutely. And so all of this is to culminate into a situation that happened to me about 3 months ago. So this was long after we saw the surges of COVID-19. This was long after I started to finally understand about sunlight, kind of a question that you asked me at the very beginning. I'm an intensive care physician, and so I usually get involved in COVID patients when they're not doing well. I don't get involved at the beginning when they get admitted. It's when they are starting to ask the question about whether or not they need to be intubated or whether or not they need to go on non-invasive ventilators or CPAP or BiPAP. So I was called down to a gentleman who was on high flow oxygen, 35 liters of oxygen. We actually did a video on our MedCram channel about this. I had his permission to talk about his case. He agreed to do it. So when I went to go see him, I went into this room. It was a negative pressure room. There was a window in the room, but the blind was closed. It was dark as anything in there. The patient looked depressed. His daughter was with him by his side. She was depressed. The first question out of his mouth to me was, "How much time do I have to live, doc? You know, when am I gonna die, basically?" So I walk in there. He's on 35 liters of oxygen, 100%. Okay, this is right. This is called high flow oxygen. This is what we use right before we put them on the ventilator, basically. He didn't look happy, and I walked into that room, and I'm like, I can't believe I'm seeing this again, because this was the first time I had seen a patient this so severely sick from COVID in probably over a year. He was vaccinated.
So it's not
Yeah.
frequent to have this
No,
situation anymore.
I'm not.
Okay.
We saw this all the time 3 years ago during Delta and Omicron, but things had really simmered down. I think people have gotten immunity to COVID in a way, maybe not so that they can't catch it again, but they're not going to get the worst symptoms as they used to. I was going to mention this guy was vaccinated, so you can see this type of situation in people who are vaccinated or unvaccinated. But this particular gentleman was vaccinated. I'm looking at this and I'm like, I know too much. I know too much. The first thing I did instinctively was I opened the blinds, and I'm like, you know what? You need to keep this window open. And then I remembered Scott Zimmerman, and I'm like, how much infrared light is actually coming through this window? I mean, not to say that there isn't benefit from just natural sunlight coming through and lights and the ability to regulate your circadian rhythm. But then in my mind I became committed to, like, this guy, we need to get this guy outdoors. But how do you do that with somebody who is requiring that high flow of oxygen? So, I'm blessed at that hospital. It's a fairly small hospital. They understand that I want to do what's best for the patient.
They're like, oh, Roger wants to try something.
That's
what does Roger want to do?
So I went out. I immediately left the room, and I went out to the nursing station, and I said, I need to speak to the charge nurse. I need to know where the nurse is, and I need to call the respiratory therapist. So the respiratory therapist who's assigned that patient, the charge nurse, and the nurse, we all had a huddle, and I said, we need to get this guy outside. And they didn't even question me.
I was gonna say, what did they say?
They know I've been preaching this gospel.
They're like, okay, Roger.
Yeah. And you know what? They were excited about it. They actually were excited about it, because I think I've been talking about it long enough. So my respiratory therapist, who, bless her heart, she is amazing. She came up with a way of combining 2 oxygen tanks at the same time to fulfill his necessary needs of oxygen to keep him saturated while we were able to disconnect him from the wall, put him into a wheelchair, and we wheelchaired him outside into the sunlight. There's a nice little area in our hospital that is a quad, and so there's nice little raised planters and plants. And the sun this was around maybe about 11 or 12 o'clock in the day, so the sun was high overhead, and we were able to get him outside. Now, this guy was so cantankerous. He was just he was depressed. He didn't want. I convinced him. He did tell me later that my energy and my excitement was one of the things that made him go along with this.
There's the T at the end of New Start.
Exactly. So We got him outside, and I said, get him out there for 30 minutes, and I want it every day. And I told him, I want this in the charts. It's a doctor's order. This guy needs to go outside every day when the sun is up for 20 minutes every single day. Okay. Now, let me give you a little bit of background. This guy was admitted 2 days prior to me seeing him to the floor. They didn't call me because they didn't think they needed me. He came in on just a few liters of oxygen. He was placed on steroids, which is what we normally do for people with COVID-19. And he was given antibiotics and all this sort of stuff for that. He continued to get worse for those 2 days, despite all of those interactions. And so after 2 days of getting worse, that's when I saw him for the first time. That's when we got him outside. I came back the next day, and I'm like, I wonder how that guy is doing. I wonder how that, and in my mind, I'm thinking, you know what? One case does not prove anything. So he could get worse. And if he gets worse, it's not going to disprove that sunlight is not beneficial. But let's see if he gets better. And you know what? I'll have to be honest with you. I pray a lot for my patients. And so, in my mind, I did that, and I did that with him. And I think that, again, that's the T of New Start at the end. So when I got in to see him, he had been significantly downgraded in his oxygenation. He was no longer on 35 liters, 100%. He was on what we call 15 liters of oxidizer, which is a substantial reduction. We got him out in the sunlight again. It came down to 10. The next day, down to 5. The next day, down to 2. Off, discharged. Home.
Wow.
I have never personally seen somebody get better from COVID as fast as I did that gentleman. And it kind of correlates with what the Brazilians found in their study, which were cut 4 days off of the patient's admission. So again, I caution you. I put more stock in the Brazilian study than I did in that one anecdotal patient. But you have to understand, it was very fulfilling for me to see and to take theoretical science, which had been published in my mind. It's not theoretical; it's real. But in my mind, to be able to take that data and actually apply it to a human being in front of me and see them get better, that was amazing. 2 things I want to mention. 2 things. Number one, he told me later, after he was discharged home and I called him up, he said to me, Doc, that first day that you took me out, that sun felt so good. And I was just like, it just melted my heart when he said that. Here's the other thing I want to mention to you as well. And this is really important in terms of where we took him out. We took him out where there was a lot of green and foliage. We know scientifically that the leaves of trees, of grass, anything that has chlorophyll in it, is very, very, very highly reflective of near infrared light. What I mean to say is this, is that you can get more near infrared light in an environment where the sun may be not so bright, but you're around green trees, green grass, than if you are in a desert with the sun coming down, basically.
Wow.
So this is important because it also explains to me why we have litanies and litanies of data that goes back decades that shows that people that live around greenery or in green spaces have better metabolic health, better lower rates of diabetes, lower rates of cardiovascular disease than people who live in, let's say, concrete jungles and cities and things of that nature. So what does this tell me? This tells me that we are living in a society that is bereft of near infrared light, that we need to get outside more, that we need to experience that more, and we need to understand some of the benefits of sunlight. That's basically it on the therapeutic side of sunlight.
Whew, thank you for that. That was a very robust overview. And I just want to say again, that I said at the beginning about being a good doctor, right? It's like you were tracking all of this research, clocking it in your mind. And then the moment came where you had an opportunity to put it into practice, be
Yeah.
like, okay, what is going to happen? And you've created an environment for yourself where you're surrounded by people who trust you. There's that D again. And you were able to do that, one-off experiment, but albeit with incredibly powerful results.
Yeah. And it's important to understand that you don't want to create unnecessary attention. So it's not like I went in there and said, let's stop the steroids, let's stop all these and just do sunlight. No, this is add-on therapy.
Yeah.
And I think when you do that, there's a lot of prejudices on both sides of that debate that you eliminate when you just simply say, it's not either or, but let's do let's do this in addition to.
Yes. Let's make, your 8 pillars of health, including sunlight, like let's make that the foundation.
Correct.
And then add whatever is needed to
Correct.
help a person recover from whatever
exactly
is ailing them.
Now let me just sort of get into the mind of some of the people listening to this. But what about skin cancer? But what about the detrimental effects of sunlight? Here's the thing that I think is really nice about infrared light specifically, and that is that your skin doesn't need to be directly exposed to the sun. If you have sensitive skin, if you're concerned about the effects of ultraviolet radiation, there's a number of mitigating things that you can do to get the benefit of sunlight without the negative effects. And here's why. Number one, ultraviolet light doesn't penetrate through clothes very well. So if you wear a layer of clothing, a broad rim hat, I'm not at all concerned about that blocking the beneficial effects of near infrared light. And it may be a good idea in terms of blocking the effects of the detrimental effects of ultraviolet radiation. Realize, though, that the more you expose yourself to sunlight, the more natural melanin will pop up in your skin and block the detrimental effects of ultraviolet radiation. Remember that there is a benefit to ultraviolet radiation eventually, and that is vitamin D. Some of us don't get enough vitamin D. I supplement with vitamin D to make sure that I do. But getting outside in the sun is important. The other thing I would mention is this, is that because infrared light is available linearly as the sun goes up and down, then you can get a lot of infrared radiation without the ultraviolet if you're outside at the extremes of the day. So in the morning time and in the evening time. Now, if you think about this is really amazing. Now, let's think about what happens to somebody who goes outside and is outside the whole day? Okay, think about this. Sun's coming up. Lots of infrared light, not a lot of ultraviolet light. What happens? This is now creating an environment in your skin and your cells, which is rich in antioxidants, melatonin. Okay? In other words, think about it as it's gearing up for the day to get ready for the onslaught of ultraviolet light. Okay? So you're building up protection. The sun is giving you the material to protect yourself as the sun is coming up. Now it hits about 10 o'clock in the morning, going around to about 2 o'clock in the afternoon. Okay? Lots of infrared light, yes, because it's coming through still, but also lots of ultraviolet light. That ultraviolet light is going to hit you with a barrage of damaging ionic photons that can be damaging to your skin and cause cancer. But you have prepared. You have prepared the whole morning by having melatonin available to mop up things, by having melanin getting ready to get out to protect you. And so you weather that storm of ultraviolet light pretty well. Now it hits around 2 o'clock. The ultraviolet barrage is now subsiding, waning off, and the sun is coming down. And now you're getting more of that infrared light. Why? In case there was any damage that needs to be mopped up, the infrared is mopping that up. And finally, the sun goes down. And in a perfect world, there's no artificial light. That allows the melatonin to come out from your pineal glands into the circulation, telling your body it's time to go to sleep, and also diffusing into the cells and doing any damage that is there in the mitochondria. This is the natural way that we experience. It's the way that we have interacted with nature for millennia, and this is what happens. So the problem, as you alluded to earlier, is when you've been in Minnesota and not outside, and then you travel to Mexico and go outside in ultraviolet rich light at noontime as you're sunning out there on the Cabana area. That anyway, that is exactly right. You hit that nail on the head.
Yeah. So yes, if we engage with nature the way that we evolved to, nature does take care of us. Nature was not designed to give us cancer with UV radiation. It's how it's possible, but it's the way that we choose to engage, which is not found in nature, right? Like going Correct. From a high latitude to a low latitude at noon and going outside at noon is not something that would have occurred naturally. That's something that we can do because we invented airplanes.
Right. And then someone might say, well, that sounds really nice, Dr. Seheult. That's a nice theoretical. Do you actually have any data on that? So a great study to look at is the Southern Sweden study. Mm-hmm. This is a study that was done on tens of thousands of Swedish women living in Sweden, obviously. So these are fair-skinned women who would have a lot of the same concerns that we would have about going out in the sun. And they asked this very simple question, is what happens when women in Sweden pursue sun-avid behavior, and what happens when they pursue sun-avoiding behavior? And so this was a multi-year, over a decade, maybe 2 decades, if I remember correctly, follow-up looking at deaths, looking at cardiovascular disease, looking at cancer rates, looking at melanoma, all of these things in comparison when they went outside into the sun and if they didn't go outside into the sun. And you have to look at the results. There's a nice graph that shows this. And it's very clear when you look at it, and this was the conclusions of the study, is that Swedish women who pursued the sun on a regular basis had lower cardiovascular disease, lower non-cardiovascular and cancer disease. And their cancer rates was interesting. This is what happened, is the cancer rates decreased, but not as much as the cardiovascular rates did. And so what happened is that when you looked at the women who did a sun-avid behavior, they went out into the sun, in other words, their proportion of cancer in all of their deaths was a little bit higher, but the actual numbers were lower. And it's because that when they went out into the sun, the cardiovascular deaths and the non-cardiovascular deaths were reduced by such an amount that overall, these were healthier than the Swedish women who did not go out into the sun. The other thing I was going to mention is this, is that even in the Swedish women who developed melanoma, the women who went out into the sun and got melanoma had better survival rates than the women who went out into the sun, who did not go out into the sun that got melanoma. They had higher mortality rates.
So that sun-avid behavior seemed to create a resilience so that even if you did end up with something, you had a higher likelihood of coming out.
Exactly.
Coming through it. Yeah, and that'd be a great place to end, is just the idea that sun is important for everybody, right? Like I hear a lot of people, they're like, oh, well, I'm Irish, or, I have red hair, or I can't go out, or I crisp up. And as you just explained, there's lots of ways to go out in the sun to avoid that happening, to get that infrared. And then on the other end of the spectrum, people with very, very melanated skin and very dark skin, do they have a higher needs for being outside in the infrared light?
Well, it's interesting because, and Scott Zimmerman actually published this in that paper. He looked at what he called melanin-rich skin and melanin-poor skin, and it showed that there was a slight reduction in the ability of infrared to penetrate, but it wasn't as significant as the reduction in ultraviolet. So where we really have an issue with darker skinned people is making sure they get enough ultraviolet radiation to make vitamin D. So somebody who has dark skin that lives in a temperate or even tropical climate that moves to a higher latitude, they are at particular risk for having vitamin D deficiencies and should supplement. Not so much on the infrared. I think anybody that gets outside is probably going to get enough infrared light.
So it's the ultraviolet. So a person with very, very dark skin will want to spend more time outside, especially when UV is present.
Yes.
And that's where the difference would be. Is
That's
someone
correct.
with lighter skin will burn more easily. Someone with darker skin needs more UV in
Correct.
order to get the benefits of vitamin D creation and other benefits of it.
Yes. The other thing I always get this question, and that is I don't believe that supplementation with melatonin is going to help your mitochondria, again, for the same reason that we talked about. You would never want to supplement with melatonin during the day.
It didn't even occur to me, as of course it doesn't.
So I don't like to see people massively overdosing on melatonin. Now, I don't mind people taking melatonin at night if they want to sleep better, or if they feel that they sleep better. But as a sleep physician, the data that we see is that the higher the doses of melatonin at night, so 10 milligrams, 15 milligrams, these are in the dose range where it actually becomes worse than if you took a lower dose in terms of sleep and sleep promotion. So I would recommend 3 to 5 milligrams of melatonin at night if that's something that helps you to sleep. But in terms of getting the true benefits of melatonin in the cells, in the mitochondria, there is no better way than getting out into the sunlight.
Perfect. And okay, just one more on the vitamin D question. So what I'm hearing you say is when UVB is present, when we're able to make vitamin D from sunlight, that's the best way to do it. If we live somewhere where there's a period of the year where we're not able to make vitamin D, you do encourage supplementation?
Yeah, I supplement with vitamin D. You should probably get your levels checked at some point to make sure that your vitamin D levels are adequate. The current standards look at bone density, and therefore the levels are around 20 for the cutoff. I personally think that's too low. Because a lot of the people that were in the studies of COVID showed that COVID-19 increased after it dropped below 50. So I try to get my levels closer to 50. You have to be careful, though, because it is possible to overdose on vitamin D, although it's very rare. People can get very, let's just say, enthusiastic about vitamin D supplementation.
If some is good,
so
infinite amount must be better.
If you're doing 1,000, 2,000 international units a day, even up to 5,000, I would say that's reasonable, but I would still make sure to get your levels checked. There are some diseases where you would not want to supplement. So, for instance, diseases like sarcoid or sarcoidosis is another name for that disease. People typically have high vitamin D levels to begin with, and so you would not want to add on top of that. So it's reasonable to get your level checked at some point to make sure that it's the right level, and then continue on if you so choose. But yeah.
Okay. Well, Dr. Seheult, thank you so much for your time, and just let our audience know where they can find you. You're on YouTube at MedCram. Is that the best place?
Yeah.
Anywhere else?
Our best place is the YouTube channel MedCram. We also have a website called medcram.com. And a lot of what we do in our business is to provide continuing medical education to physicians, to nurses, to physician assistants, respiratory therapists. And we go over a lot of medically themed videos talking about pulmonary function testing, for instance, EKGs. So we do a lot of that solid, kind of medical stuff. But we also talk about health in this respect of what we talked about today as well.
Okay. So there are some modules in there on sunlight?
Absolutely. Oh, yes.
Okay.
If they wanted to turn
we'll have to link to those.
Yes. So Light
we
is
have
medicine.
A site where we send all the practitioners to get continuing education. So we'll put that on there. And those are, you get CMEs with those, correct?
Correct. Yes.
Great. Wonderful. Well, that is, just as I said earlier, such a service to the healthcare professionals, but also just to all of us in general, to have a doctor who is so curious and intelligent about, learning learning. I'd say new things, but I guess it's more things that we've forgotten when
Yeah,
it comes to sunlight.
it's surprising how much that nothing really is new under the sun.
Yeah. Oh, thanks again.
You're welcome. Thanks so much. I appreciate it, Meredith.
Woohoo! You made it to the end of another episode. Thank you so much for joining us on this exploratory adventure into new realms. Your energy and support are building a different world, and I am so grateful to be on this journey with you. Take care, and thanks.